How are loupes changing? And why would you need to change? Let me show you where I started. That's my first pair of loupes. Wow, what a hideous thing. I would hook it on the dental assistant, the chair, whatever. So I went down to that size, and that was, I got 2 power out of that. And then it started to get sophisticated. There's one where it actually had the headlamp and the loupes on the same encasement. And another jump up. They're changing angulation a little bit. And now where are we? I have Scott Malcolm with me, CR scientist, and he's done a lot of research on this. It looks like I can go from 3.5 to 6.5. Why do I want those things hanging down? And I'm looking straight out of the other wall.
Yes, these are new ergonomic prism loupes. These allow you to look straight forward and to be able to see the operating field. And there are many individuals who are suffering from crippling back pain and neck pain.
Neck and back pain.
Yes.
We're worse than any other profession.
And these allow you to, they resolve that. They allow you to sit upright. It's very similar to working at an operating microscope or an endodontic microscope. Mm-hmm. You look straight forward and you're able to see down in the patient's mouth. And so there are some advantages.
What would you say would be the major advantage? And be broad in what you're thinking.
Certainly to be able to solve those ergonomic issues. I've heard from clinicians who they're absolutely debilitated by pain and they don't know how they're going to keep practicing, and these have really helped them to be able to overcome that.
I had a 30-year-old in here recently, Dennis, who used to work for us in this when it was CRA, and he's already got his neck fused at age 30 from humping over, as most dentists do. If they hump over with their whole body, it gets the back. If it's just the head, it gets the neck. But we are the worst profession of all with musculoskeletal problems. Well, are there some disadvantages?
There are some significant disadvantages. Not everyone is going to enjoy that upright procedure. I know I've seen you operate and you are moving all around, and these, you're very limited in how you can move. You have to be very upright. So they work well for things like hygiene, endodontics, and certain procedures where an upright position works just fine. But others would have a really hard time adjusting to this.
Well, visualize it. Let's say I'm doing just the 6 upper and lower anterior teeth. The field is narrower with these, and it's shallower with these. So how am I going to get all 6 of those teeth into the image? Not very well. So let's look at the other side of that. Of all the crowns done in America, 90% are singles. Now you're talking. You're down to about that field. And they do about 250 of those a year. 90% of implants are singles. Again, you're right down to one little hole. So that would be, are there other advantages to them than the ones we've already discussed?
Ergonomics is the main advantage. Some other disadvantages, when you look at these loupes, you'll notice that they're located right in the center of the glasses, and that's great for you to be able to see. However, when you're not working and you want to communicate with a patient or with your assistant, they're right in the middle of your optics.
There are a few brands that are trying to move them down to the bottom of the lens so you can just look at the patient like that rather than moving your head up and down. So there's an evolution that's going through. It'll be a while.
That's very true.
But if you're already, as a younger dentist, feeling some neck pain, it's time to look. Now, I've presented this concept in many courses over the last couple of years, and about 1/3 who try this don't like it. But about 2/3 have become accustomed, and some of them would never go back. So if you're even contemplating a pain, you better look at them. And they're coming from all the companies. I've just shown you a couple there. All the major loupe companies are now making these. Are they more expensive?
A little bit.
Yeah, overall.
Yep.
Yeah. Well, thanks, Scott, for sharing your time with us. We appreciate it. Thanks for being with us. Join us next week.